In this video, I'm going to break down Medicare Parts A, B, C, and D so that you can finally understand the whole system and how each part works. We'll start with original Medicare Parts A and B, then move on to Medicare Advantage, that's Part C, and prescription drug coverage, that's Part D. I'll show you the real costs for each part, what they cover, and the two main paths that people choose when they're turning 65 and getting into Medicare. My name is Adrian. I'm an independent licensed health insurance agent. I have personally helped hundreds of people figure out their Medicare options for their situation. Now let's talk about original Medicare. That's Medicare Parts A and Part B. You're usually eligible for both Medicare Parts A and B when you first turn 65. You can qualify earlier if you've been receiving Social Security disability benefits for 24 months, have end-stage renal disease, or ALS. Medicare Part A is your hospital insurance. It covers inpatient hospital stays, skilled nursing care, hospice, and some home health care. It's premium free for most people as long as you or your spouse have worked 10 years or 40 quarters and have paid Medicare taxes during that time. If you qualify for premium free Medicare Part A and your spouse doesn't, then your spouse can still get Medicare Part A premium free through your work history. Now, even though Medicare Part A is usually premium free, there are still some out-of-pocket costs. For 2026, the inpatient hospital deductible is $1,736 per benefit period. A benefit period starts the day that you've been admitted into the hospital and ends when you've been out of the hospital or skilled nursing facility for 60 days in a row. Say you've been admitted into the hospital and you paid that deductible. Here's how your out-of-pocket costs would work as of 2026. Days 1 through 60 is $0 in coinsurance. For days 61 through 90, you'll have to pay $434 per day. Now after that, you get a lifetime reserve of 60 days where it's $868 per day for that hospital stay. After that, you pay all of the costs out of pocket. Skilled nursing facility care follows a similar structure. Days 1 through 20 is $0 to you, and days 21 through 100 is $217 per day. And all costs after that is out of pocket. Medicare Part B is your medical insurance. It covers things like outpatient care, your doctor's office visits, ambulance rides, durable medical equipment that could be your wheelchair or your walkers, preventative care, and more. Unlike Part A, Part B does have a standard monthly premium that most people pay into. The standard premium is $202.90 per month. However, that can be higher depending on your level of income. Part B also has an annual deductible of $283. After that, Medicare usually pays 80% for all Medicare-approved services, and you would be responsible for paying the remaining 20%. That's why lots of people get a Medicare Advantage plan or Medicare Supplement plan to help cover those costs. Now we'll move on to Medicare Advantage, which is Medicare Part C. Medicare Advantage is a different way to get your Medicare A and B benefits. These plans are offered by private insurance companies that are approved by Medicare. So instead of original Medicare paying your medical bills, the private insurance company does. You can only join a Part C plan if you have both Medicare Part A and Part B. Most Medicare Advantage plans also include Part D prescription drug coverage, but a lot of them can also include extra benefits such as some basic dental, vision, and hearing care that original Medicare doesn't provide, and maybe even an over-the-counter allowance that you can use to go buy things at the store or a gym membership. On top of your Part B premium, some Medicare Advantage plans might have an extra monthly premium, but many of them are $0 or free. Something important to note with Medicare Advantage is that they usually have their own network of doctors, meaning that you may be able to only see certain doctors, hospitals, and specialists within certain areas that accept your plan. Many Medicare Advantage plans also have what's called a maximum out-of-pocket, which limits the amount of copays and out-of-pocket costs that you have within a year. This lets you know what your worst-case scenario medical costs would be for the year. Moving on to Medicare Part D, this part is responsible for paying for your prescription medications. Original Medicare does not have your prescription medications covered, so you'll usually have to add a Part D plan alongside of that. Again, like I mentioned earlier, if you have a Medicare Advantage plan, which is different from original Medicare, your prescription drug coverage can be included in that as well a lot of the time. Part D plans can have some premium as well. Some can be free, some can range between $13 to $60 a month. There is also a late enrollment penalty with Part D if you don't enroll when you first become eligible. So even if you're not taking any medication right now, it could be a good idea to enroll into Part D plan anyway. That way you can avoid any future penalties. Now I know that was a lot of information, and you might be worried about some of those out-of-pocket costs as well. There are ways to minimize those, and people usually go two paths in order to do that. Path one is staying with your original Medicare Parts A and B, and then adding on what's called a Medicare Supplement Plan, also known as Medigap, and a Medicare Part D plan as well. Now, there are some Medicare supplement plans like a Plan G that can cover all of the out-of-pocket costs that original Medicare charges. This means that with a supplement plan, you can have the peace of mind that when you go to see a doctor or have an emergency and go to the hospital, that all of your medical bills would likely be 100% covered. A supplement plan is designed to fill in the gaps in original Medicare. Path number two is to go with the Medicare Advantage plan. Now, that 20% coinsurance and those deductibles with original Medicare could get expensive depending on some critical conditions. A Medicare Advantage plan can lower those out-of-pocket costs and add extra benefits as well. They also usually have that maximum out-of-pocket that we mentioned earlier that will limit your worst-case scenario costs. The trade-off with them is that you usually do have to pay copays whenever you go get medical care for certain services. There also is a network of doctors and providers that you usually have to stick to. Both paths can be great. It all depends on your health, your doctors, how often you need care, and your budget. If your income is low, you may qualify for a Medicare savings program that helps you save on your Part B deductible, or you may qualify for Medicaid, which is also another program that helps you pay for any premiums, deductibles, and coinsurance. If this video helped you understand Medicare a little bit better, consider subscribing. That helps YouTube push out the video to other people just like you that it can help. And you'll be up to date on all things Medicare. Again, my name is Adrian. Thanks for watching.